Anyway, let's continue. So, why the issues with Weiterbildung started to happen? So first part, as I have mentioned already, there is no real control over the quality of the practical education process in the ambulatory healthcare, and logbook is just a paper for speculations by the employers. Facharzt specialist examination is rather a theoretical exam. Second part, there is no serious requirement to show the educational program by the practices who receiving the Weiterbildungsbefugnis, so allowance to educate, thereby technically nothing to control, as soon as they do not show any special evidences, like their program, how they're gonna educate, like day by day, then yeah, you can't demand anything actually. And yes, thereby the best place could be huge clinics, hospitals, and unfortunately it's limited amount of spaces there, so not a lot of doctors can apply there easily. And that's how it works. So that's why a big pile of the doctors like really have to try to go to ambulatory healthcare and try to get finally somehow through the different praxis their logbook filled up. Employers sometimes actually misinforming young doctors over the possible education which is possible in a particular praxis or area, and this part exactly makes the education of the assistant arts in Weiterbildung is kind of like a lottery. So you might be able to fill up your logbook, you might not be able. I know people, for example, or students who were assigned and then after like a year turned on that actually they're like where they work right now, they are not eligible anymore to sign the logbook. There also was a court deed to let's say to give a try actually to get signature somehow. So there is somehow really messy process. So on the one side, employers just try to get people for free because KV pays and do not really control. And on the other side, sometimes there really can be misinformation. And if young doctor tries to push the statements into the contract that like you are as employer need to provide me, for example, particular education, this type of the operations, whatever, yeah, in most cases it will never be signed. So at least we tried and it didn't work. And as a result from the previous ones, the filling up of the logbook, it just also takes undefined amount of years. So depending on the different specialty or type of or direction which doctor has chosen, their requirements, for example, either like up to 6 years basically needs to be done to fill up the logbook using the different, let's say, places and different type of the operations and activities. And up to 6 years it might take if you really straight like go one by one and fill up everything in one, for example, hospital, then yeah, your path is very straightforward and easy. But if you start to jump, it might become a nightmare. So like it definitely and easily go in much longer period of time than this particular period, like that 6 years. So yeah, it's not that easy. On the other side, yeah, I know a lot of Germans, they actually put themselves into the queue and they're waiting and waiting, so they kind of graduated, but they can still wait for their, let's say, a place in the big clinics. And of course, a lot of, let's say, also students who are going to the medical university, especially if they're German ones, most probably their parents also are in the medical industry, so they know like where to like, and they actually know how to apply, how to do it faster. They do it really in advance. So sometimes like if you're a local one, you have small advantage because you just know the system, and if you have parents who are in this industry, then you are having even bigger advantage at the end. But yeah, it's not for everyone applicable at the end. Another interesting finding during filling up the logbook in general, then learning to do a surgery is a prerogative, then a mandatory part of education. the strange term. I had to suffer for years, wait, and now you have to suffer. That's an unfortunate mindset of a lot of the doctors, clinic owners or practice owners in the ambulatory who have this permit to teach young doctors, or who have this Weiterbildung allowance to get the doctors. Usually you can hear the statements from X generation, so like a little bit older than generation. And here I come slowly to some, let's say, topic like generation differences. As soon as I already mention it, like known right now, or let's say makes sense for us to discuss right now, 3 generations: X, Y, and Z. Generation X, it's just basically those people were born during the reconstruction of the Europe after war. So it's between 1965 and 1981. Usually their typical traits are that individualism, ambition, and real addiction or addiction to the work. So kind of a workaholic approach. And yeah, this is the values which with which they were grown up. And now exactly the Generation X, they are close to retire. And as a replacement for them appear Generation Y. It's basically mid-age right now. So it's 1981 and, or were born between 1981 and 1996. So unlike from their parents from Generation X, they already, let's say, raised on the technologies, like called also digital natives. And in most cases, this generation is not really satisfied with the world around. They're thinking how to improve, how things can be maybe simplified. They're ambitious and want to achieve the goals, but not always tend to be workaholics, which means that they try to do things faster, more efficient. So they really can work hard. I mean, I also same generation can work really hard, like, but on the other side, definitely we respect flexibility, and actually the Generation Y is focused on the results. So not ready to stay for ages in one place if there is no result, and not ready to leave for the work or leave it. Yeah, and this generation exactly taking over right now. Generation Z is the last one which we need to mention here in this talk. They were born between 1997 and until 2010. This generation basically is even kind of extraction from the Generation Y. So also want to get things faster, but rather even immediately, as soon as it's needed, like really fostered on a digital world. And yeah, basically in this world they are just really immersed. And basically the lifestyle of this generation is dictated quite a lot by social media, for example, YouTube or so on. And flexibility, possibility to work remotely, like on a short period of time, for example, is kind of in their mind, and it's a must-have. And this is a future generation. So this exactly, they are in their early 20s, so they finish an education at this moment, and they are about, like, pretty soon to start going to the Weiterbildung, so on. So this is 3 generations which we need to mention, and the reason why it matters. The thing is that, as you saw already, like as soon as I started to explain a little bit about each of them, each generation has own strongness or strengths and weaknesses. And motivation factors from one generation is not always would work pretty well for another one. So like words like do it as I did 30 years ago definitely wouldn't fit. World has changed, and a lot of things around have changed during the last 30 years. As a result, change in the interests and in the motivation factors also dictates the employees and their involvement into the process at work. And usually every new generation, they are more flexible in the mindset. At some point, they are more active, willing for the change. So they can easier abandon things, can faster to change, can faster to make decisions. And if they don't see quickly the result, just abandon it. Which also actually include the profession change, the country's changes. So kind of globalization also like will jump into the next area or next stage already, or it's already jumping into the next stage. So as you see, a lot of things are just different and they depend on the generation. And the actual owners of the private doctor practices, of the ambulant practices, they are rather from generation X, while big pile of their employees are already from Y generation, so they are younger and they are about to replace them. And of course, a lot of X generation employed sometimes seems already burnt out. It doesn't matter if they are owning the practice or if they are working in the practice. Sometimes the system, how it's built, they already burnt out. They are already about to retire. They're just waiting for this time. And yeah, of course, it brings additional unhealthy situation in the industry, and it's still kind of remain also additional unhealthy factor. And yeah, X generation in this case, following their mindset, basically they also build a kind of unhealthy regulation or a relation at work for the newer generation, and they kind of make them also to abandon the profession or lose the motivation. Even like things I have suffered for like 10 years or 15 years just to be able to do the surgery. Maybe it worked 30 years ago, but actually that's not the truth, because I also had a talk with some old doctors who already about to retire or actually retired already this year, and there was much better structure of the education. So, but yeah, some of them of course had to pass some complexity problems on, but it doesn't mean that the newer generation need to do and repeat the same issues again just because someone did it in the past or had to. Yeah. Learning of surgery is really a must. Basically, often education to make a surgery is considered as by employers as a benefit, at least across Germany, and not as a must-have. So conservative treatment basically conservative treatment is just the generic checkup of the patient without surgeries. So conservative treatment is assumed to be main workload in Germany instead of subspecializations. And how to reach actual excellence at work if you repeat the same basic thing again and again and again. So for example, as a doctor, you are treating constantly runny nose. I mean, does it really help you somehow? Or you just try to, I don't know, treat red eyes at the end. So it will be cured itself by the body. But it doesn't help you to somehow do the, I don't know, lid chirurgy or whatever. Or you're just doing some stupid paperwork. It doesn't help you to advance as a doctor. So technically surgery and understanding how it works is really must have for a big pile of the subspecialization in the medical industry. Basic surgery. Basically, it's assumed to be something extraordinary by so-called educators in Germany. As a counterparty, in some countries like Netherlands or United States, some surgeries are made by nurses, yeah, or by just other personnel, not by specialists, just because they are simple. Even some simple injections or whatever in Germany have to be made by specialists, by Facharzt, which is ridiculous. It's just overkill. Also, like absurd case that in Germany, for example, a big pile of nurses in some practices, they can even decline to make any kind of very, very simple intravenous injection. Basically, it's task of the doctor. So let doctor do everything, which is fine, but it's just big overkill. So doctor just spends a lot of time on that trivial tasks that doesn't really help somehow to actually cure the patient. I mean, patient just need to be prepared but I mean, doctor also needs to do the preparation in Germany. Also, just as a remark, for example, reference to the Netherlands or to United States, in some countries you cannot be even named as a specialist or Facharzt without knowledge how to make basic surgeries in your sub-specialization. So it's key just to graduate and to become and to be able to be named as a specialist or Facharzt. You need to do particular base surgeries. For example, if you try to search for like work in the Netherlands as a doctor, let's assume you're eligible to work there, you would see a completely different set of requirements compared to the generic German Facharzt position. Surgeons which are right now work in Germany, unfortunately in most cases they avoid teaching anyone because they are afraid to grow competitors, and they prefer to keep young doctors somewhere outside. So they can just sit on the generic checkups, they can quickly check the post surgery stuff, or they can just do additional very simple paperwork. Also they maintain the patient flow on the right level to be sure that there is enough, let's say, income going to the praxis on the one side. On the other side, as soon as you're doing the conservative treatment, you also can catch a bunch of, let's say, people or the patients who potentially need the surgery. So I would tell that conservative treatment is the prerequisite to be able to get the patient for the surgery, and that's how it works. So financially beneficial if young doctor just sits on the conservative, trying to catch as many patients as possible for surgeries. If they not, let's say, or if surgery is not applicable, then just do conservative treatment and make money on that. There are already difficulties for the doctors to forward patients to get specific surgeries in Germany, in the neighborhood. So yeah, it's not really relevant for very big cities, but for the smaller ones, this is already confirmed, at least like after the talk with a bunch of, let's say, doctors in surroundings. There are cases when doctor in particular practice, they don't have this type of the operations, they cannot provide it at all, but they know that like in the nearby bigger city and there is a hospital available there, and there's a doctors or few doctors who are doing this particular type of the surgery. So this person and this hospital can help to the patient. What doctors does, logically, sends the patient to that particular hospital to get treatment. And yeah, sometimes patient driving 100 kilometers, even 200 kilometers to a particular hospital from home, and hospital just rejects it because yeah, either they have no capacity right now, or there is lack of skilled staff to handle it. Reason behind, yeah, doctor who was doing this type of the surgeries decided to leave the hospital because of the maybe unhealthy situation in the hospital, or too much work, or so on. So doctor left and there is no staff, no one can actually take over. There is already a reality. It's not actually even imaginary cases.